like my cousin wrestled, my papa wrestled, but like it was not a big sport back
Welcome.
there. So I think
How you
that's the fun jump that
Dr.
it's like massive
John,
up here. It's really cool.
John. It's very territorial. Like just Wisconsin's big in wrestling, but you go to certain parts of Wisconsin. I don't know. It's not. You know what I mean? So
I'm gonna turn this down a little bit.
Yeah. So the part you got.
It's on my desk. I got it. I should probably stop bringing in plastic, but the water jug wasn't in until today, and I'm like, I drank the dirty water last week.
All right, well, we'll get started. Everybody's here. Thanks so much for all of you for attending. My name is Dr. Eric Wallace. I am the owner and founder here at Modus RX. Usually our summer events are a little bit lower in attendance, kind of like tonight. But I think if more people knew that it was 95 degrees and we were breathing in all this wildfire smoke, maybe they'd be more productive tonight by coming to a shoulder and elbow class. So if you haven't heard of us, if you haven't been here before, we are trying to do our best to take a sledgehammer to the traditional model of medicine. Since I started the business 10 years ago, that's what we set out to do. And so first things first, we always try to lead with education for people. We try to give people as much information as possible to help them make a good decision moving forward about what we offer and what we can do. And then secondly, hopefully when we grow a team, we build a team of specialists. And so you're going to hear from Dr. Emma tonight, who is our specialist on shoulders and elbows, neck, upper quadrant. She is highly, highly skilled in that area, graduated from Columbia University in New York, so clearly plenty intelligent from the neck up, and really has done a great job with specialty certification in dry needling. We're going to talk a little bit about our shockwave devices tonight, and probably the most important thing, what we do over here in the gym to help build up strength, stability, and confidence. So Dr. Emma is our go-to for that. You're going to learn a lot from her tonight. And then also Becky is our glue. So if you have any questions tonight, you need anything tonight, you need anything beyond tonight as far as logistics and how things work, you can reach out to her. You can talk to me. We'll all be around for questions afterwards. So with that being said, thank you so much for being here. And I'll turn it over to Dr. Emma. And make sure you get in my live stream picture here. If you see my signals in the back.
I feel like I gotta be like, I'm such like, no, I don't like that side actually. We'll just stay on this one. Okay.
There you go. You're good.
I have a lot of pictures in here too. So like Dr. Eric said, my journey to PT. So I was senior in high school. I swear I went through the route of I'm going to do PT, I'm going to do speech, I'm going to do OT. And then I finally, what solidified me on PT was actually got injured myself with swimming. I swam for 14 years, had a shoulder injury, which you'll see it on the next slide. But like Dr. Eric said, I did my undergrad in Pittsburgh from Chatham University. So I was there for 3 years and got my bachelor's in exercise science. That top part, that's a picture of our beautiful city from Mount Washington. And then I did go to Columbia in New York City. So I was there for 3 years. I miss it. Better here, I think, because I have my car and I don't have to lug groceries up 80 steps anymore. But I did have to put in a picture of Yankee Stadium because as much as I like the Brewers Stadium, Yankee Stadium's a little better. Just because you get the background of the city, and I was 2 blocks walking from Yankee. Okay, so when I said shoulder injury, that's how my back looked half of my senior year of high school. So a tremendous amount of cupping. I was in PT probably 3 times a week, sometimes 2, and then eventually we dropped down. But with swimming, so I was a butterflyer and I swam sprint freestyle. So the way my injury basically started was we had a meet one day. I was in the car on the way and I'm looking at my dad like my shoulder is killing me right now. And it was just straight pain right in this front region. Had no idea. I mean, I didn't go through PT school yet. I didn't go through undergrad yet. So I had no idea what was going on with the shoulder. I had originally tried like a sport chiropractor who he was awesome, but it was a lot of like modality work. So he would pull out the ultrasound, we would do massage, we would do cupping. I had the Normatec suits on and that was great. But as soon as I stopped seeing him and my season was done, it wasn't helping. So then my senior year, I made the jump to go to PT, and that's where I learned about like the rehab process. So I was getting actual like tangible exercises I was taking home with me and stretches, posture re-education. And that took my pain from like way up here to nothing. Had one of the best district meets of my life. We tied the record. So that just kind of solidified my jump to PT.
Wrestling for a long time, so that was a lot of just constant abuse to it, right?
Mhm.
Grabbing, hold on. So over time, I'm hard tissue and things like that. So I've been going into like chiropractors and
Okay.
things like that. And then did a couple of ETs long time ago in college. But since then, I just thought I could do it myself, but that's the spot.
Yeah. Oh, that's great. Anyone else want to share? Totally don't have to. Never been? Oh, well, ever? Welcome into your first PT clinic. Okay. Ooh. Okay. So talking about the shoulder and the elbow, I kind of like separated them out. A lot of people experience both at the same time. Does anyone want to like tell me what's been going on with their shoulder and their elbow? You can feel free to share whatever. You don't have to share it all. Anyone got anything?
But like what's going on is like most motions are fine, but when I grab it, I go back like this. It's like right here, and it just really.
Okay.
I go back and
Okay. It's just in the shoulder, not the elbow.
no, just the shoulder.
Okay. Anyone else got anything going on?
For me, it's any motion that requires strengthening
Okay.
in one direction. And I look away from here, close here,
Okay.
and really into elbow too. But
So you're kind of hitting both of those joints then, yeah. Yeah, okay, awesome. Anyone else?
Back my like shoulder blade right here. That's
Couple weeks. All right, we'll chit chat later. Okay. I guess we kind of discussed it a little bit, but I guess what I want to know, describing the pain, I put a bunch of different words we usually use here. If anyone, is it dull? Is it achy, sore, sharp? Anyone get any like tingling or numbness down the arm or in the shoulder? Yes, the tingling and the numbness, or just it's dull and achy.
like sharp
Okay.
and like
Is it like during practice or do you usually experience that after too?
this.
Okay. Yeah. Do you have any tingling or?
Yeah, mine is just when I touch it because I tore my UCL and I didn't
Gotcha.
get surgery, so it's just like whenever I touch it, I can feel it up in my.
Your pinky.
Yeah.
Okay. Yeah. Anyone else? Sharp. Okay. And then the other question that I had was I went with almost like an athletic type of theme here, but your life from the bench. So because of your pain, what is it keeping you from doing, if anything? And then what are you struggling to do? So is there anything you're still doing, but it's just not being done the way that you were able to do it prior to your injury? If anyone wants to share?
sleeping.
Sleeping. Okay.
Trying to put my arm under the pillow.
So it's the getting comfortable and falling asleep, or is it staying asleep too?
It depends. Like I did a shoulder day today, so like tonight might be a rough day sleeping.
Okay.
And then if I try to like put my arm underneath the pillow and sleep too long like that, oh man,
Tough.
I'd be numb for hours.
Yeah. Anyone else have trouble sleeping, getting comfy? Same thing, just positioning the arm. Okay. Anyone over here? Yeah. We'll talk about sleep too.
I'm getting undressed.
The overhead movement, yeah. Okay. All right. Maybe we'll do. I feel like if all 6 of you are saying sleeping, we'll do a little position demo with some pillows that I can show you guys what to do. Okay. And then the last question I have for you is, what's your why? So what brought you kind of to us, to our workshop? What do you want to be able to get out of our conversation today? Not a pain. That's a good one. Anyone else got anything?
What's making it worse?
Okay. That's a good one too.
How to prevent it going forward.
Great question too. Anyone else? Okay. Okay, so I basically designed this in like an analogy to like a car. I know I don't work on cars, but as long as, do you guys ever, you can drive? Okay. You guys are, it's a younger license here. That's what I've learned moving here, because Pennsylvania, it's 16 to get your license. Here it's 15. But I wanted to go with like a car analogy because I think that really helps capture what like the shoulder and the upper body does just as a functional unit and how that injury can arise. So the first component of this is know your engine. So we're talking about the shoulder and like the elbow joint as like a whole. So this is kind of what your shoulder joint looks like. So this would be, I believe it's a right side. So you've got your main arm here, which is your humerus. And then you've got, oh my goodness, your clavicle, which is that collarbone. And then that actually meets that shoulder blade. So kind of where you were talking about the pain, those three bones actually connect. And that's what we're kind of like referring to as like the shoulder girdle or the shoulder like joint itself. Within the shoulder itself, besides muscles, there's a ton of ligaments and there's a ton of other things. So the ligaments, the tendons run through here. You can even see some of these like blue and like red lines going down. You also have a ton of nerves and arteries. You also have what's called, has anyone heard of like a bursa sac or like what a bursa is? So you also have these like fluid-filled sacs within the joint, which is basically to prevent friction, shock absorption, making sure like when you're doing movements, like nothing's pinching in there. So that's the shoulder. And then anatomically, we got some muscles. So this is the inside. So if you take your shoulder blade and you flip it over, we've got or is that the back? Oh, I guess I didn't put a picture of it. So there is a muscle on the inside. It's very hard to see the way we can access it with our hands. You actually have to go in through like the armpit, so it's not like the most comfortable thing. But then on the top, we also have three more muscles that makes up the rotator cuff. So you have this little guy here, this big one, and then this one on top. If you were to put another layer of muscles, then we kind of get into what this looks like over here. So then you get like your rhomboids, your levators in here, and then these two pictures highlight the big guys. So your trap goes on top, your delt, and your lat. So it's just essentially peeling layer by layer all of those muscles back. And that's where like the pain can come from. So sometimes some people might have pain in one of those top layer muscles. Other people might be down on like those bottom layers as well. Okay, getting into the elbow. I'm sure everyone's familiar with tennis elbow, golfer's elbow. So depending on what side your pain is, that's how we kind of classify it. So tennis elbow is on this outer little bump over here. So we call it the lateral epicondyle. Usually people will have pain with wrist extension, so bringing that wrist up, and then supination. So if you think about like turning your hand out, so a lot of times this could present with like turning a doorknob, or if you're using like a wrench or a screw, just motions like that. Golfer's elbow is on the inside, so it's just directly opposite. This one is pulling your wrist towards you, so flexing your wrist, and then pronating, so turning the wrist down instead of up. That's usually the pain patterns that we see with those individuals. So this is, I believe this is an outer elbow. Hang on. Yeah, so this would be the outer elbow. So we have that extensor compartment over here. Regardless, the biggest takeaway here is that you can see this is where that shoulder bone kind of meets that forearm bone. All of those muscles are still attaching here. It also connects up to the shoulder. So thinking about like your biceps and your triceps, biceps and triceps are going to start up here and back here. Those are actually going to attach to the back of the elbow and at the front of the elbow, in addition to all of those muscles that start at the elbow and run down to the forearm. So it's just acting as like one big chain. So everything is connected somehow. There's never like a free floating muscle. It's always going to have a start and it's always going to have an end. What that means for you guys, though, is that if something is not feeling good up top, like say in your shoulder, and it gets very tight, that's where we also might feel that pain down at that elbow because it's a two insertion joint or two insertion muscle. So it's connecting to two different surfaces. Okay. All right. So the second part of this is what happens when your engine overheats. So now we're kind of getting into the stages of pain and all of that. So this little diagram here, a couple different things we see as like physical therapists, and it's based on the way we could be in conversation in the street, or if you're in here telling me this. One of the biggest things that we see causing this type of like overheating, first one's an increase in activity. So whether you're an athlete, if you guys go from like your off season, do you guys do any sort of like preseason training where they like crank it up, or you have like just like a really hefty load week with your training, or not so much?
Like once a week leading up to the season, like the first week is kind of light, and then moving forward.
Okay. Yeah, so with sports then, so like that gradual increase, I know I also played water polo, so we would kind of like have summers. You never stop swimming when you're a swimmer, but we would have that time off. And then my coach would say, hey, water polo preseason. So I was in a pool 4 hours a day. We were lifting after, just that soreness stuff I was not used to. For anyone who may have played sports, but you guys have transitioned into more just like an active everyday role, anything that you guys can think of where it was like, hey, I went from here and now all of a sudden I'm doing this increase of work? Any personal experiences? Anything? I know this could be like, for me, it was going from putting my groceries in my car and making, he's now my fiance, making him take the groceries, versus I had to carry a book bag in 2 Trader Joe's bags of 80 steps. So I would say that that's kind of like the jump that we're looking for when you're going from an activity that you've never done to an activity where it's like you're doing it all the time and we see that pain. So then the next one would be movement compensation. So I'll use my grocery example. So I'm carrying my groceries. I'm not used to this motion where I have a book bag full of things and my arms are here. Sometimes the bags would rip and I'd have to carry them like this up the stairs. So instead of being like nice and tall like this, sometimes I might want to lean to one side, or I'm like hiking in this motion and like holding it here. So now we're starting to see movement compensations that are not within our normal. Might feel normal in the moment, like, oh, this takes away the pain. But eventually down the road, your body gets adjusted and stuck in that cycle of like, oh, this is a great way to do things versus the correct way to do things. So then when you try to go back to doing it how you used to do it when you weren't in pain, then it makes it a little bit harder. And then your body immediately wants to jump back to, no, let's just do it the way that I learned how to, like, it's a cheat code essentially. Do you have a question?
Well, yes, what you just said is, so if I have a shoulder injury that I've been nursing for X amount of years,
Yeah.
and I just been picking up more and more pickleball, because that's the reason why I feel like I'm getting tennis elbow now.
Yeah.
That'd be due to that compensation.
Absolutely, I think. And I think it would also tie into, we'll get into this a little bit later, just the way that your muscles are stabilizing. So if we also have that lack of stabilization within certain muscles and you're already compensating at the shoulder from everything, elbow's next in line where it's like, oh, it's my turn. Now I'm going to do stuff that I should not be doing. So it can lead to that like kind of chain effect where
Sure.
Here's 1, here's 2, now 3 is going to take over. Any other questions with that? No? Okay. The next one. Any questions on overheating? Okay. And then the last component of this is your engine runs out. So this is when we see the pain now turn into that injury point. So a couple different things here. And again, this is based on just our time as physical therapists, what patients have said to me over the years, what I've seen as a physical therapist. I mean, I work out over at Crunch Fitness and I've been on the treadmills before, and I get a full like view of the gym and I can see exactly how people are lifting, who might have an injury, who might not. So the first one that we typically see is just that loss of motion. So active motion, meaning I can like lift my shoulder all around, which some of you have already expressed we're having a little trouble with that, but also passive. So if I were another person, so if I had two people, me taking my arm and having somebody else lift it, sometimes that can also get restricted based on the type of injury. The second one that we see, a lot of this is sometimes with athletes. So my wrestlers, I don't know if you guys ever have experienced this, but you just have a loss of like arm power and speed. So you're going from like, hey, winning match after match after match, to all of a sudden in practice, you're like, I can't even like wrestle because my arm feels like it's going to fall off. That would be another thing we see. Same thing for like gym goers, your active adults, any activities you guys do in your every single day life, where it's like, I was able to carry these groceries yesterday and now I can barely pick up a bag of them. So those are the things that we're kind of looking for. If we had any people here who played like overhead sports like swimming or like throwing with like baseball and softball pitching, another thing we would look for is that arm speed. So not just the power, but the speed of how you're throwing, the speed of how you're swinging your arm around to be able to swim. The next one is just that sense of instability. So a lot of the comments that I get here is my shoulder going to give? Like, is it going to give out? Or this doesn't feel stable, or they're not moving the joint. So a lot of people come in, they're ready for PT and they're holding their arm here because they do not want to move it, because they have a fear that if they move it, something's going to pop out of place. Another one with that, it's just that increase in anxiety with any injury. It's just that fear of, is this ever going to get better? Am I going to wrestle at the same capacity I was able to like a year ago? Can I hit my gains in the gym? Can I do any of the activities that I want to in my daily life? Because injuries are stressful and you never know, because it's just kind of thrown at you and it sends you for like a little bit of a curveball and you have to like modify and like change everything in your life. And then the last one is that pain with movement. So again, this could just be going from those daily activities or the gym or wrestling, and all of a sudden you have to take breaks when you've never had to take breaks before, or you have to change your activity, or you just have to fully stop and say, hey, like I can't do this today. So those are some of like the biggest out of fuel changes that we see with just shoulder and like elbow injuries. Does anyone have any like personal experiences they want to share? Totally don't have to. Yeah.
I had tendonitis in my and I was in an exercise class and shot and something felt like popped with pain. And after that, I was going to go back to class because I didn't know which motion is going to hurt it.
Hurt it, yeah. And I feel like it's that fear of like, that's where it happened. And now you're scared of going to something that like you love to do. So yeah, no, that's a great example. Anyone else have anything?
My like first time back on the mat after getting injured was a little scary, and I was like, I just had a lot of anxiety about it because I was out for like 4 months.
Oh my goodness, yeah.
First time back was very scary.
Yeah, I can imagine too. And you guys do not play a light sport either. So it's not like you're just jumping in a pool. You got to actually like take somebody down. All right. Biggest question based on all of that and why we're here is, how do I fix this? So the usual process that we see, especially within medicine and physical therapy, are like the most common first steps. Typically when something hurts or something's injured, the first step is to contact like your PCP doctor. A lot of people will actually reach out to orthopedics as well, just to get a better idea of like, what did I do? This all of a sudden started hurting. Like that's when you think of like the medical field, that's typically all people know is go to the doctor. From there, the doctor usually can do a couple things. The first one, depending on what you're presenting with, they might require like imaging. So they'll say, hey, go get an x-ray or go get like an MRI done just so we can get a better idea of the structures. Sometimes though, this can create like that fear avoidance pattern where it's like we have the injury, we want to get injury, but hey, let's not move this joint at all. So we have a lot of like fear and anxiety surrounding this injury. But then also too, it comes down to when is imaging appropriate. So I guess I'll backtrack a little bit or jump ahead. So you can see PCPs and orthos, but what a lot of people don't actually know is that Dr. Eric and I are actually considered like direct access providers as well. So if you have like an injury that you think it's a muscle, a bone, a tendon, ligament, whatever it is, you can actually call someone, or we'd hope you would call me or him, and we can actually get you in here for an assessment. Our doctorates are within like musculoskeletal conditions and just knowing the body. So this is something we'd be able to help with. If you were to go somewhere with that route, with imaging, usually some doctors will tell you to go to PT in the first place. So if you're already coming in and seeing us directly, like it's already like jumping the gun almost, because if they tell you to do PT before imaging, then you're already in the right place. What we kind of look though for with imaging is we'll try PT for about like 6 to 8 weeks. We call it conservative treatment. If somebody's all of a sudden not responding to the treatment and we're not seeing any changes and we've been working together for a couple weeks, that's when we might send somebody in and say, hey, why don't you go back to your doctor and see if you can get scheduled for like an x-ray or an MRI. The other one too is if you're just starting to present with like some other symptoms that are not necessarily like aligned with like muscles or the skeletal bones and all of that, that's also when like an image would also be warranted. Another one is just I believe it's like just sleeping in general. So not necessarily with what's going on with you guys, but like this is the person who cannot get comfortable, cannot sleep. You're sleeping like 2 or 3 hours just because the pain is that bad. That's also when we would kind of warrant that imaging to be taken. The next one, has anyone ever had a cortisone injection? Nothing? Okay. So cortisone stay away from them. So cortisone injections are another way of just providing that patient with like pain relief. It's a great idea in the moment. And I'm not saying like you should never do it. Like if that's something that you want to go through with it, or if your doctor's recommending, by all means, like you listen to your doctor. However, in regards to PT, it's more of a get the cortisone shot, but you also want to be doing preventative care with physical therapy and not just relying on that pain relief mechanism. Cortisone injections are what we like to classify as just that short-term relief, but it's a long-term issue. So you get the pain relief for about like a couple weeks, couple months, but then all of a sudden the effects of the shot wear off and you're back to square one. And you're like, oh, I have this pain again. Because in that meantime, we didn't do any strength training. We didn't do any stability training, anything like that to kind of readjust that body to a pain-free standard of motion. The next one is the pain medications too, where sometimes you walk in and they're like, here's ibuprofen, take it for a couple weeks. Again, that falls into the same thing with the cortisone injections of just, it's that short-term temporary relief, but not the long-term effects that we want to see. Okay. Any questions on this?
Just add something, Dr. Emmett?
Yeah.
So in terms of the cortisone injections, the tenocyte and chondrocyte, those big fancy words, if anybody's followed professional sports in any matter, have seen kind of an increase in ACLs or Achilles tears, things like that. The tenocyte and chondrocyte, comment there, it's basically the cortisone it's reducing your body's ability to produce these important cells. So a lot of these athletes are probably getting injections to get back out in the field quickly and make sure they can play. But then as they get older or they get longer in their career, those injections have actually created breakdown in their tendons and ligaments, and they're more prone to injury later on. So it's just kind of one of those things where I think the analogy I've used with people is, you know, you're turning off the smoke alarm, but you're not putting out the fire in that case. So just something to consider for long-term considerations. A lot of these decisions we make in the short term because we're frustrated, we're in pain, and we want answers quickly, we want results quickly, but there is a longer-term effect with those cortisone injections that often isn't talked about with the orthos that are providing them.
Any questions on that? Okay. So we have our approach, which is the Modus RX approach. Dr. Eric just briefly touched on it. So the first step that we take here is you're coming in, you're telling us everything that's going on with your shoulder. Depending on how much pain you're in, that's our baseline. So the first thing we want to do is to be able to put out that fire. So getting everything out, making sure that pain goes down so that way we have like a functioning body and are able to do things without being afraid of having pain or pushing through pain like we just talked about. The second part, once we get that pain out, the next thing we're going to jump into is finding the hidden cause. So that's when we're breaking things down. So as Justin was saying earlier, is it my shoulder or is it my elbow? Is it something that I did while I was wrestling like 30 years ago? So we kind of take a look at not only what's in the moment, but we also take a look at what your history is. So even if you're coming in and telling me, hey, I played this sport like 10 years ago, that's still pretty relevant to me, because something that could have happened in an injury 10 years ago where you didn't properly heal or properly rehab that muscle or that bone that was injured, that can all be playing into effect. The next thing after that is building a bigger cup. So the fun part, and you can see around the clinic up here, is that we push you in here. So we're going to teach you, like I always say, movements medicine. So exercise-based interventions to help relieve your pain, certain stretches, certain stability drills. We're going to do it all so that way that cup is filled to the max. Once we have you in a good spot, that's when we start to push you. So we'll get into more like plyometrics and doing some quicker motions, and we focus on speed, endurance, and power. And then the last step after that is that eventually you graduate from us. Doesn't mean you can never come back, because like our door is always open. But our goal as therapists is to allow you to reclaim your life. We're here for you. We're always in your corner, but we want you to be able to go out in the real world and feel like you have your life back. You're moving at 100%, if not more than 100%. Okay. So then with putting out the fire, a couple of different things we do here. So as Dr. Eric mentioned, we do dry needling. I just completed my upper body certification in dry needle. I probably will be going in August for my lower body. So you're safe from me from the lower back down for now, but upper body's fair game. So with dry needling, the course that I took, I had the opportunity to take a really cool course on Saturday morning, it was a 3-day course. I was in there for 27 hours. Saturday morning, we had about a 2.5-hour lecture on biochemistry. I have not touched biochemistry since my undergrad years. But basically, he was running us through just how like a trigger point is formed within the muscle, just how things get tight and wound, and the effects of dry needling. So when that needle's put in, we are able to, I know for my practice, I go based on, we were taught acupuncture points. So I find the trigger point, I always draw out my landmarks, I put the needle in, and essentially it's into that trigger point. So that spot where you're like, hey, this like really, really is bothering me. With that, there's a technique too where it's like almost like winding the needle. And basically what the research was showing was the more that you're winding the needle, we're actually able to like reverse the effects of how that trigger point was formed. So that way the fibers are nice and flat, not bunched up. With your shoulder blade pain, there is a really cool technique we can talk about a little bit later, where I would actually, you know, the muscle I was talking about, you have to go in through the armpit. One of my favorite ones to do is actually taking that shoulder blade, and I'm able to like pull it with my fingers a little bit, and I can actually go in with a needle on the back side and get that to release. I've had really good results with it, especially with pain specifically in that shoulder blade region. The next one is regenerative shockwave therapy. Has anyone ever heard about this or seen it? Okay, we're gonna do a little demo today with it. Justin told me he would be my volunteer. So jump starting, this is like jumpstart healing. So with shockwave therapy, this one uses like the acoustic or like the sound waves. I always describe it to every patient that I do it on. Yes, I can do manual therapy. Yes, I can do stuff like with my hands and like the cupping, but my hands can only go so far down into your body. Essentially what this does is these acoustic and these sound waves penetrate down through the skin into like the muscles at like the cellular level, and it's going to jumpstart that muscle to heal. So it's going to increase your blood flow. It's going to decrease your pain. The tissues, I always explain it like we're breaking down the gunky tissue to allow an inflammatory response to occur so we can rebuild it back up healthy. When I say that, it doesn't mean we're going to cause like inflammation in your body, but it's almost like with the more chronic an injury. So the longer an injury has been going on, sometimes the body forgets how to like repair itself. So taking the shockwave machine, we're just adding that little boost of like, hey, like you got to actually do your job. We trigger that process for the muscles and the bones to re-stimulate to reheal and re-stimulate and all that. And then with manual therapy, so a couple different things here. We can do joint mobilizations, soft tissue mobilization. So where we're working on your muscles just with like almost like a massage technique. We have cupping. So that was what I had done on my back earlier. And then we also have the instrument assisted soft tissue mobilization. So it's a tool like this. I had it out earlier. Is it, did I move it?
Looks like a butter knife.
Yeah.
Basically.
It's like anyone ever heard of like Graston? No. So it's like a big long like piece of metal looking thing, and we just scrape your muscle, and it feels awesome. I promise. But okay. So Huh?
I don't think anyone's ever said that.
No? Hear it from me. It's great. I've had it done to me. Real quick, this is what dry needling looks like. This is actually my arm from a couple weeks ago. I did not do this to myself. I had someone else do it to me, and then I did it to that person. But for like the outside of the elbow and the inside of the elbow, this is a pathway we can do to target the bicep coming down into that forearm. So where that outer elbow usually causes pain. This one was my favorite. So this was the inner elbow here. So this is my right hand. So this is my inner elbow here. And we actually tracked the pathway of one of the nerves. So it's your median nerve in your forearm. A lot of the times when a muscle gets tight, a nerve can also get tight, which a lot of people don't fully realize. It's hard to explain what a nerve tightness feels like because everybody's different. I know for me, when I do it, it almost feels like I'm pulling like a spider web off of my hand. But it almost feels like the difference between that and a muscle, like you can almost feel like a rope being pulled. That's what a tight nerve feels like. So we actually track this all the way down through this compartment here. And then my favorite, does anyone ever do a lot of work with their hands? So we can actually needle your palm. So we went in right here, 3 needles here, 1 needle here. I took this class 3 weeks ago and I still have better range in my right arm that was needled than my left arm just from having especially these 4 little needles placed. But yeah, I promise it's a lot of fun. And they're like tiny, they're tiny little needles. They're not big. Okay. And then we have the Shockwave. So before we get started into like our little demo tonight, a lot of questions that we usually have about this is how does this differ from ultrasound? So ultrasound, if you ever go into like another facility, some places have it. I've seen it at Kairos. I've seen it at PTs. Even some doctors have it. It's just like that gentle little nozzle that you move back and forth. Usually ultrasound is used when someone's like in acute pain. We have that pain flare up, but it's very surface level. Shockwave therapy has a higher pressure and like faster pulses to get down through that tissue. And then what that's going to do, like we talked about, is stimulate that biological process. So breaking down the tissues to rebuild it up. Compared to other treatments, like I said, everything kind of does its own thing. So there's certain modalities that are used for pain management, stimulating a muscle to make sure it has its function. The shockwave therapy is from doing all the research that I've done when I first started doing this and like looking at other techniques. This one is one of the only ones that I was seeing that really truly triggers that biological process. And then, like I said, the chronic versus the acute conditions, you can use the other things for acute conditions. You can also use shockwave for acute conditions as well. So that instant like pain, stuff like that. The difference is the chronic condition. So Justin was sharing just about his elbow pain he's been dealing with for years and years and years. You can use this type of technology on an injury like that. So we can still work on breaking down that gunky tissue to rebuild it healthier and stronger and pain-free. So we're going to get started with our demo. You're still cool if you demo? Okay. Since you pointed at like your delt region, which one was it again? Okay. I'm going to have you have a seat. I can do one or the other. We'll do like a mini little demo. Bring this over. I would like to preface too, it sounds worse than it actually is. It's very loud, but it's not bad, I promise. And then how's your pain tolerance?
Good.
Okay. I'll start you off at like a medium one, but you can always tell me like bump it up higher, bump it up lower. All right. Okay. So I'm going to grab a towel and some gloves real quick. So this is like a 3-step process, and we'll just do a little bit of each one. So the first thing, if you were to come in for a shockwave treatment, the first thing we do is desensitize the area. So I use this little nozzle thing, and then show me where it was kind of bothering you. Right back here in the delt. Okay. So the first thing we do, like I said, is a little loud. I'm just going to run this over that spot there and just almost like warm up the tissues that I'm applying this to. This way.
Anybody ever use a massage gun or Theragun? It's kind of like a glorified version of that, just to warm up the tissue first before the thunder and lightning.
All right. Okay. Once that's done, then we take the ultrasound itself. So there's two different like nozzles that we use. Okay, so the first one is this flatter, broader one. So with this, what I'm going to do is we just go in a bigger pattern and a fashion. So I'm going to work through the spot he told me, but then around the surrounding tissues as well. When I switch over to the smaller one, so this bullseye one, that's where it goes right into the spot where you're like, this is the spot where I'm having the most pain. And we just focus on that small little area. I guess I should have done. Can you stick your arm out to the side? Okay, don't let me push it down. Ready? 3, 2, 1.
David, did you say you had the UCO?
Then go
Yeah.
forward.
Are you still having?
3, 2, 1. A little rocky on that one.
It came off my bone and I never had surgery,
Yeah.
so it's just like scar tissue.
Yeah, like if you were holding that.
Okay,
pushing down.
hold the arm here. Don't let me push. 3, 2, 1. Yeah, a little weak there.
Yeah.
We're gonna see how this does. I'll retest those 3 when we're done too. So I just did a little pre-test with him. Not too bad, arm out to the side and front. It was that extension position. He held it for a second and then fully collapsed. So we're gonna retest it after a mini one. Okay. Okay, you ready?
Mhm.
Like I said, it's louder than it looks. So we're just gonna go right through here. Right there. Too much, or is it just good?
That's fine. You can try it. Yeah, yeah.
Better?
Funny that you can actually feel that, like pain where.
Where it's bothering you?
Yeah. It's like it's activating it.
So I'm just taking this and running over that sore spot, but then I'm also targeting this entire like delt region as well. Feel okay?
Right.
All right, we're gonna do the bullseye. How did that pressure feel? Did it feel too light or just right?
How'd you describe it, Justin?
It was activating the areas that were sore without moving. It was weird. It was like putting yourself in the position where you're feeling it starting to hurt without having to move it. Like it was doing it for it.
Now we're gonna work the bullseye position. So I'm gonna go straight into the spot where he was like, this bothers me the most, and that's where we just hang out for a little bit. So right through here. Feeling okay?
So you said pain tolerance. What's the level it's set at? Compared to-
I have you at a 1.5. The highest I've ever set it to someone is like a 2.0. So you can kind of go, depends on the person. I've had people tell me like, hey, I don't feel anything, and they're on the highest setting already. I've also had people where I've had to crank it way below at least 1 just to make it tolerable. Which no matter what, it's still doing its function. It's just about what makes you comfortable, making sure you're in a comfortable environment before we do this. All right, let's tuck it up here too.
Oh, that's quite okay. Yeah, you're on something.
It's probably because I kicked your butt last night.
Probably.
Justin, I teach hot Pilates classes on Tuesday, Thursday, and Saturday, and Justin's my right hand man. He's always up in the front, but I kicked his butt last night.
Take your classes.
Hardest class.
They're very.
It was not too bad. Okay, to be fair, I'm like, it's not too bad. But the way I teach class, I'm like, yeah, two donkey kicks. You guys keep going, and then I walk around the room. So I don't do the workout. So I actually don't know how bad it is. But
My favorite crunch class. Best and hardest.
okay, we're gonna go ahead and retest this. So go ahead and arm out to the side. Don't let me push 3, 2, 1. It's better. Front. 3, 2, 1. All right. Moment of truth. Back. Hold it here. 3, 2, 1. That's much better
That's way
than your
better.
first one.
Yeah.
Okay. Thanks for letting me
Thank you.
do that, Tia. Any questions on that? No. Since you guys are a smaller group, does anyone want to see a cupping demo done? Anyone want to see cupping?
Sure.
Do you want to be my guinea pig? Come on up. We'll do a little cupping demo. Okay. And then which shoulder was it that was bothering you? That one. Perfect. Okay, so there's 2 different techniques that we do with cupping. There's probably more out there, but these are the 2 that I usually do. So I do a dynamic moving cup, and then I'll let the cups kind of chill and hang out, which sometimes gives that like, well, how my back looks, the octopus one. Depending on the person, I turned a lot more red just because I had years and years of like tissue buildup within my shoulder, and it really hurt, just a lot of pain. But depending on the person, I've had people leave here and they're not red at all. So you were saying kind of like right through here.
It's here, here, here.
Okay, we'll start up right in here. So I usually I take a little bit of cream. So this is gonna go just right into this little elbow part here. I'll put some over here, and then we can move it down there too. Okay, so my first pump, and we do not do the cups with the needles. I know some people are the fire. I've seen multiple versions of it. Ours is just suction cup. So it goes on like this. I'm gonna find that spot, go right over. I'm gonna give it one little pump. The first technique I do to warm up the area is I just do almost like a little sliding technique. So I'm just running this cup up and down, trying to break up some of those adhesions in the tissue. Feel okay?
Wonderful.
And then once that feels good, I give it a little extra pump. I leave it. I'll grab 2 more. We'll do those spots too. I highly advise if you ever have cups at home, don't cup your head. I was 17. I never told you this story. I was not in PT school yet, but my physical therapist I was seeing was like, yeah, buy a cupping set. So me and my middle brother, Sam, we had our little brother, Jack, who we're 7 years apart. So I think he was 10. We're like, yeah, let's cup your forehead. So we took the thing, did 1 squeeze. He immediately turned up with a purple spot on his forehead, and he had to go to 2nd grade the next day. So he went to school with a big circle on his head. I just found that picture the other day, and I thought it was funny. So we'll get right back there. Does that feel all tight too?
Yep.
Okay. We're just warming up through the area. Here. Now
I think I can't feel the front one anymore
you're good. You're good.
because the back one took all the attention.
We'll work through this little region too. Usually with cupping, if you come in and see me, and this is something we do, I always follow it up just with like a little bit of soft tissue work. So we take off the cup, just got a little mark. And then I always do just some soft tissue work through that tissue just to keep breaking it up. Some people, depending on like what you're presenting with, sometimes we'll throw dry needling with it too. I have dry needled and shockwaved in the same session. I've done just dry needling. If we were needling today, I'm not going to do a needle demo, but essentially like with this deltoid muscle here, I would kind of go right in through here just to kind of break up along this line, just some knots in like that mid delt region. We can also do the back and the front delt. There's some work we can do in the bicep. One really cool one I learned was actually going in straight through here just to kind of break up all the tight little ones that end up in that region. This one too. How are you feeling so far? And then we'll two. Okay. All right. Go ahead and move that arm around. Let me know how that feels. Does it feel any looser than like 3 minutes ago? Maybe a little bit. Yeah. With any of these procedures too, dry needling, shockwave, cupping, it is normal to have just a little bit of soreness because, I mean, we are working deep into those muscles. A little bit of soreness is totally fine. Just we recommend drink water after. I know with shockwave, usually we say like no ice or ibuprofen for about 48 to 72 hours just because we want to like let that inflammatory process happen. Heat's totally okay because heat will just bring more blood to it. So that'll be fine. But thank you. Any questions on cupping or shockwave? Great. Okay, so then we kind of get into just some early stages with like exercise-based treatment. So this encompasses some, but not all of the things that we do here. Anytime you come in here, we always like to preface that it's an individualized treatment plan. So if you're coming in for something, it might be different from what you two might do, and you two might not even be doing the same thing. So we always tailor it to who is the person that I'm seeing, what are you experiencing, how can I make it better, what do you want to get back to doing? With mobility, I personally always start our first session together. So I eval you, we do some treatment. I always start you off with like what I like to call setting exercises and mobility. So, and it depends on what you need, because some people don't need mobility, they need other things. So then that's where your plan of care would change, essentially what I'm giving you. So with mobility, we have like static and dynamic stretching. So static stretching might be something like arm comes across the body. Dynamic stretching, something like shoulder squeezes where I make you hold it and all of a sudden you're pulling through the traps, you're pulling through the pecs, really squeezing. So then you get that muscle activation along with the stretch. Then we also have range of motion targeted exercises. So if somebody was having a hard time reaching like their arm forward, sometimes we'll have you do like a towel slide across the table, or we'll have you towel slide up and down just to start introducing range of motion. With this too, we do a lot of checking. We can do a fun little one. So if everyone wants to take, you can take one hand and reach it behind like this. And then you can even switch and compare and see if you can feel one going further than the other. And Dr. Eric's behind you too, so he can take a peek. Yeah. You're actually symmetrical. You're good. How we look over here? That looks good. How would Justin, you look symmetrical. You actually guys, you all look good. I mean, we're only reaching base of the neck, but both sides are doing it. And then the other one too is we'll usually have people take hand and reach opposite. So we're just looking, well, you can see it. I lifted on Monday. So I can still get this hand here. My right hand is only coming to here right now because I feel a lot of soreness through here. But just looking at mobility, reaching wise, it's going to go internal and external. Can't get your arm up?
That's as far as it goes right there.
And shockingly, it's my left that can reach, and I'm a righty. But yeah, those are fun little ways to look. You can also do things like I said, like overhead reaches, reaching out to the side. It's a fun little game you can play with like your friends or your family. And like, oh, you need to go to PT because you only have one arm here and the other one can come up here. Then we get into like the strength training. So this can be the first session. This can also be it's going to be every single session after. So we have some things called like isometric holds, where these are really good for like pain relief, and it's really good for like muscle activation. So I know one of the ones I've done, Dr. Eric, you can chime in too. One of the biggest ones for like flexion I've done is having people like hold a punch into a wall and you're just like punching. So that way we're getting like a serratus activation. We're also getting a little bit of that forward flexion. I don't know if you have any specific ones you've done in the past.
Come up with whatever we want when it's necessary for whatever's happening.
Yeah.
But
It's one of those creativity where we can adjust the exercise based on how you're presenting. So if you think about the movement that's painful, we will come up with something for you to do in isolation in that movement to make it less painful. Then we also look at functional pattern strength training. So that's almost like, we'll get to this a little bit later, but working the chain. So I am the type of therapist, when you come in, I'm not going to be like, oh, we're going to spend 40 minutes on your shoulder. I'm going to work your elbow. I'm going to work your shoulder. I'm going to work your core. I'm going to pull exercises that will even involve your lower body, where I'm making you hold a squat. I'm making you hold a lunge. And all of a sudden we're working the upper body, because the body doesn't just work in one segment. It works as a unit. So you can't just train one unit and not train the other stuff. We also definitely always go both sides. So if you're injured on your left side, you're not only going to work the left side, we're also going to work the right side. So that way we have that symmetrical balance with strength. Self-myofascial release, we'll teach you techniques in addition to what we do here, just to do trigger point release, and then just some like tissue mobility and like the pain relief. So I don't know, you know, our like, okay. Does anyone have like a tennis ball or lacrosse ball at home? Something small like this. So you can even take something like that, little bit of gentle pressure, and just rolling it into like the forearm. You can get the other side. One that I like to do is going against like a wall. This would be a good one for you. Find that tight spot with the shoulder blade, and you're going to stand there, and you can either hold it, or sometimes I like to rock back and forth. I would recommend starting with the standing wall one. You can do this laying down too. Sometimes it can feel a little intense because I've done it before. And I'm like trying to avoid it. And it takes me 5 minutes to be able to sink down onto that like small little fascial release ball. Okay, and then the last little part here is that comment just about working the chain. So not only do we have muscle movement in the bodies, but what a lot of people tend to forget is we actually have to look at your spinal mobility. Somebody who might have limited range of motion within their shoulder or their elbow, a lot of the times what we're doing is we're actually clearing the cervical, so your upper spine, the middle of your back, and the lower spine as well. And then I actually look at your wrist mobility too, especially with the spine. Sometimes if one segment gets locked up compared to the other, that can actually like limit your movement. So I don't have motion that great. You can ask Dr. Eric. I don't have great motion in my like mid back here. So sometimes because I can't move that, like I can't rotate through that part of my back, my shoulder will compensate. So sometimes, especially like when I'm lifting, I've texted him before where I'm trying to lift and I feel everything straight through my shoulder instead of in my back where I'm supposed to be feeling it, because I don't have that mobility. So that's just another like key component that we're doing, is we're clearing your spine, seeing how everything's moving in conjunction with each other. Okay. And then this just goes relating back to working that chain. So like I said, the body works as a unit, talking about how one joint might be affecting the other. So if my mid back's locked up, that might affect my shoulder, and we want to look at the whole picture. Then we do the functional testing. So we do the isolated range of motion and strength. So the muscle arm test presses I was doing. And then I look at how your functional stuff looks. So can you hold a plank? Can you do a push-up? If it's your lower body, how's your squat look? How does like your knee control look? And then based on all of that information, that's when we connect the dots to give you your individualized plan of care that's not designed for anybody except for you. Okay. And then that leads us to getting you back to you. So like that's that comment of just building your bigger cup. So bottom line is we want to make sure you have confidence. So when you come in here, it's not just PT, exercise, whatever. Like I said, we're in your corner. So you get to tell us whatever you want. I love to get to know people. I like to yap during my session. So if I'm just bombarding you with like 50 questions, that's usually how the sessions go. But we want you to feel calm and in a safe environment, especially when you're having anxiety around those movements. So that way you can feel confident in doing it. And with my, the way that I treat, like I will always give you something here. And until it is pain-free and comfortable in here, that's when I send you outside of the clinic. Like, hey, you can do this in a gym now because I know you're safe with it. And then it's just to challenge yourself in new ways. Like I said, I teach hot fitness classes, and I always tell them every single class, like, I never give you things that I don't think you can handle. So if I'm throwing something crazy at you, it's not because I'm trying to make you fail. It's because I know you can do it, and we have to learn how to challenge that body and like those new movement patterns. And then we also have that graded exposure. So building to the complex and compound movements. This could be moving from a body weight to me giving you dumbbells or a kettlebell to plyometrics, where we might have you doing like drop catches off like the barbell, or I saw a really cool one that I'm waiting for the perfect patient to do it with. But it's like a dead bug exercise, but you're hanging from one arm to really get those compound movements in. Okay, and just a little bit of a bonus slide here. Sometimes people aren't injured. And a big question is, well, if I'm not injured, why would I go to PT? This is especially true whether you're an athlete or if you're someone who's very active or just someone who wants to stay ahead of the game. You can see us even if you're not injured. So we like to recommend people come in for that pre-screen first. So what the pre-screen is going to do, and like you guys could do this before if you have teammates who you know are prone to injury, you come in for this pre-screen where we're able to see what compensations are you moving with. What's your muscle synergy weakness? So where's this weakness presenting? What's your lack in range of motion, if any? And then are you unstable at all? Like, how's your shoulder moving? How's your elbow? How's your neck? Then we can jump in based on what we see into what we call prehab. So this prehab, so pre-rehabilitation, it's improving your strength, mobility, and stability. It increases your endurance and your power output, and it decreases your risk of injury because you are already one step ahead of the game. You came in and you saw us. When you go into your season, it's going to decrease that risk of injury because we've taught you how to move and how to increase like your power and your power output, your endurance output, all of that. Okay. All right. I'm going to open up the floor. Does anyone have any questions or anything they want to share? If not, I have a list of questions I can kind of go down and answer. Would you guys just want me to do that instead? Okay. So John, your question was how to reduce shoulder pain and increase range of motion. So it kind of goes back to everything we talked about. So when you come in here, we're going to give you like those isometrics, and we're going to work on like gentle range of motion and all of those modalities to get the pain out. But then the exercises we do is, like I said, like the scap squeezes. We have to learn how to set the muscles first, and then we take you into range of motion and gradually increase. Another thing we can do is joint mobilization. So sometimes people get really stiff and like locked up in the shoulder. So we have techniques where we can actually take our hands, and they're very subtle movements, but just kind of creating a little bit more space in that joint to allow things to move a little bit more freely. So can I answer your question? Okay. And then Tatiana, yours was, does sleep position aggravate the shoulder and how to solve for that? So with that, yes, it can. So if your injury is on the right side, I am a side sleeper. I don't know about everybody else. So sometimes sleeping on that side of the shoulder here, that can aggravate it, which can make it pretty hard to like get comfortable and fall asleep. What I like to tell patients at night is I always take, I know people don't like to sleep on their backs, but well, I'm just going to hop on the table real quick so you can see. So when someone's sleeping at night, if you're a side sleeper, usually I'm going to recommend sleeping with like the affected shoulder up just so we get pressure off of it. One of my favorite things to recommend is that you hold a pillow kind of right here, because that's going to take this shoulder nice and open versus coming right in here, which your pec muscles sit here. So if you already have tight pecs and now you're sleeping like this for 8 hours, that's just going to cause it to get even more tight. So you want to sleep with that shoulder in a nice relaxed position. The other things that I like to tell people is if you can sleep on your back, on both sides too. I like to cushion with pillows here because that's also going to open up through the shoulder versus like being here or like here. So we have that nice aligned posture. The last thing you can do, you want to take, do you guys have like extra like washcloths at home or like something tiny you can fold? So if you fold it on like a small layer like this, if you guys have questions about this too, I can always re-walk you through it. You want to take something small like this and roll it so it's like flat, not like this, because this will be too high. But I like to take this and I actually stick it right underneath at my neck, because then that's going to take you, especially if you're sleeping on your side or your back. If you're on your back, it takes you from here to neutral. If you're on your side, instead of being like tilted this way or tilted up, it's going to give you that little bit of support so that way you're next to neutral. But that's what my PT made me sleep like that years and years ago. And my pain went from up high to down low and things felt so much better. And then I was not a good patient because as soon as I stopped seeing them a month later, I went back to sleeping on my side. Okay. The next question was, had an elbow dislocation in January during a wrestling match, still dealing with some pain at times and wondering how to lessen this. Where's your pain at? On that inside?
Mostly on the inside, and sometimes it's in the back area.
Okay. So with yours, because it was a very traumatic thing, you were out for like 4, you said you had surgery, correct?
No, I
You did not have surgery. Okay. So with that type of pain, that kind of goes back to like that stability conversation. So if I had to guess, and that's why we would love to be able to get you in here so we can get a look at like your back and your shoulder muscles. My biggest thing I would recommend would be if you do you lift and stuff, or you guys, okay, focus on a lot of like upper body lifting. You can even ditch the weights and just focus on, okay, I got to strengthen up my back muscles and I got to strengthen up the shoulder muscles. Sometimes when we have that consistent pain, depending on how you're wrestling, it could just be one of those movement compensations where we might not be using the upper body, or maybe we have a little bit limited in like spinal mobility. And that's putting a lot of pressure through here as well. Does that kind of help answer your question a little bit? Okay. And then your question was how to take care of a torn labrum and the spacing in the labrum. Have you had a labrum injury before? Okay. So very similar answers. So one of the biggest things, again, so you guys could even do it together if you guys are lifting, really focusing on the active stabilizer. So because the labrum is like one of those tiny little structures in there, it's a little bit different of a healing process. So usually when we have like a labrum injury, what we'll try and do is strengthen up the muscles around it to create that stabilization. So that's a good one. And then if you ever came in and saw us, like I was telling John over here, we can also do those joint mobilizations just to create a little bit more space within that capsule to kind of decrease pain and then open you up a little bit more so you have more range of motion. Then Aaron, your question was the pain behind the left shoulder blade. I'm going to sound like a broken robot, but I swear it works for everything. Again, just strengthening up those rotator cuff muscles. I would also say too, because I've had some people in your spot, a lot of what my treatment plans look like are stabilizing the shoulder, doing like some delt work, but I also pull in a lot of core muscles too, because sometimes that's where the other compensations we see is that if someone's having like that shoulder pain, it actually might be coming from the core and just not being able to stabilize through the core. Some people have 6-packs and they walk in here and they're like, my core is fine. And then I throw them in a bird dog and they're falling over because they don't have that core stabilization. With you too, I think if you ever wanted to pop in here, some of those dry needling techniques would also be very beneficial, especially getting up and underneath that shoulder blade where you're feeling it. Like I said, I've had really good results where I've had someone on the table, they get up and we've got more range of motion just from putting 1 or 2 needles into that spot.
Yeah, I can do everything. It doesn't really bother me. It's mostly when I'm sitting and driving, like that.
Just that
position
pain.
is-
Yeah. Yeah.
getting that there.
Come find me after. We'll chit chat. All right. And then that leads us to like our little ending. So the best way to get started, because you guys decided to come in and see us today, we're going to recommend you stop by with Becky and get your free discovery session. So the discovery sessions usually run between like 45 minutes to an hour, depending on how much someone has to share. I always describe it as like the tell all. So you get to tell me, or if you get scheduled with Dr. Eric, you tell us everything that's going on. And then we run a couple quick screens just to give you a more clear picture of like what is going on, where our professional brains are thinking. Based on that, we can recommend if you're appropriate for like that initial evaluation or consultation and get you in for a full workup where we're taking range of motion values, taking strength, and then we get into like the manual and the therapy and all of that. Because you guys came today, if you book and are interested in this discovery visit, we're actually going to give you guys a $100 credit to a service of your choice. So that can be applied to your evaluation price. It can be applied to your treatment plan. If you think the shockwave was awesome or dry needling sounds good, you can apply it to a dry needle session as well. And then we also have Kelsey, who's not here tonight. She is our therapeutic massage therapist, but you can also use credit and apply it towards a massage as well. And then this is just our way of saying thank you for joining us and coming in to better your health. Yeah.
Thank you.
No other questions? All right. Awesome. Thanks for joining.
Anybody has any questions that they don't want to ask out loud, we will be around to talk in private.
Thank you.
Not too bad.
You're good.
Thanks.
Do you think it'd benefit if I did drive needle?